Okay, today is the day off surgery, second surgery. It kind of feels like deja vu. It's about 5:45 a.m. right now, and I guess the only thing different is I kind of know what to expect this time, and I have some more hair, so I'm not as bald. Well, let's get to it. Walking to the doctor's office. You sleepy? We're in the office. There's a doctor, and I'm almost ready to go in for the transplant. So my hair was just washed and taken pictures of. I was recording video. Okay, so right now the doctor's poking in holes in my head to see how many grafts can be taken. Oh, it's bad right now? So, I probably just saw my head bloody. Level isn't bad. So here I am getting the transplant done. Kind of like this haircut. Let's see what it's looking like. I can't even see it. Hopefully you guys can. So the pain level is not that bad, obviously. They numb you out, and yeah. Not much really to say. So what they did is they poked holes this time first so they could count how many grafts they need. I'm getting it done in the crown, right here somewhere. I don't want to touch it. Should I say something?
Hey, this is recording.
How much pain I'm in right now, like excruciating pain.
Would you have that smile on your face if you were in that much
Please
pain?
tell them stop.
Funny, he starts yelling.
Yeah.
It's actually recording now. So.
Oh, okay. No, it's good. There's no pain. So the procedure just got done. Whenever we're using his back camera, it's kind of tough to angle it just right, and then you can't see my head. I'm going to try to sneak it out from under this laser real quick. I hope you can see that. I'm going to sneak it back in real quick without trying to hit it. Okay, so surgery's just done. I'd have to say this time the pain level was a lot less. I mean, look at me, this is literally right after it. Feels good. Felt great. Felt as good as a hair transplant will feel. It was really relaxing, relaxed environment. Okay, so this is how it looks right after the surgery. Whether you want to see the top, and you can see I feel fine. I feel great. I don't feel pain. The doctor says he's going to take me out to a party tonight, and we're going to go party. So that's how good I feel. I'm just kidding, of course. You probably don't want to do that with the grafts in your hair. It's going to mess that up. So I'm back now, home after the surgery. I've sat down and relaxed for a little bit, and I feel like a ninja with this little headband on. So when I left the hospital, I left with this little hat on, this surgical hat on, and then he told me to take it off when I got home. So things are a little bit different this time from the first surgery. And I'll talk to you about the differences because it's on the crown. And I don't know if you can see that. Yes, hopefully, yeah, it's under the lighting. And you can see this right now. That's where I got it done. And of course these bandages are going to come off tomorrow. Oh, I thought I saw some blood on my ear. Yeah, I do. Anyways, so These bandages will come off tomorrow, and I'm applying ACell. So things that are different is because it's on the crown of my head, he doesn't want me to touch the back of the head while sleeping. So this time, either I'll try to sleep on my couch, or I will try to, well, this lighting is really bad. Or he said sleep on my stomach on my bed, which is right there. So either I gotta sleep on the bed or on my stomach this time. And it's tough because I tend to roll around at night. So let's see how I do. I'll make a video tomorrow. I wanted to talk to you guys actually this time right now about the... Oh, and because it's on the back of the head, I don't have to wear a bandage on my head to reduce swelling, because there won't be swelling this time. It's on the back of the head. So, I mean, I recorded some of the stuff while I was doing surgery. You can see there wasn't really much pain, and if I ever did feel any pain, he just injected me with some more anesthesia. I like the way he does anesthesia. He injects you till you don't feel pain. He doesn't go overboard with it or anything, and if you start feeling a little more, he injects you some more. So, the post-op procedures right after surgeries, this is saline in this bottle. He gives this to you, and he wants you to spray this on your graft area every 10 minutes. I know that sounds like a lot, so, and I guess it's just to keep it moist, so I'm doing some right now. Just a tad bit, just a little taparoo, that's all. There you go, what I just did right there. That's it, plain and simple. You just do that every 10 minutes. I know it seems like a lot, like I said. I think last time it was only every 30 minutes, which was a little better. Now this is the stuff he gave. He gave some pillowcases to put on your pillow so you don't have bleeding. He gave an extra surgical cap. These are the medicines. What else did he give? Oh, and then he gave instructions on the post-op, and then he gave me a ton of ACell right here, and this I'm going to apply 3 times a day on the area, the donor area, and this is to help ensure that some of the donor hair actually grows back. Actually, about 50% is what we're hoping, is what's been proven, but he says it's more like 35, I think. So that has to be applied every 30 minutes. No, I'm sorry. 3 times a day, and I have to massage the scalp, the donor area, starting tomorrow, so it prevents ingrown hair. And that I start tomorrow. Then comes patient monograph. Okay, I don't know what that is. It's all for the medicines. Let's go. He provided the medicines, which are pretty nice. So this is I think Vicodin right here. You only need to take Vicodin if you're feeling any pain. Take 1 pill and it should go away. This is take 1 tablet by mouth every morning with food. This is the prednisone, and this is all to help healing and prevent ingrown hair. That should be taking 1 tablet every morning till they run out, and it looks like he gave me 4 of them, so for 4 days. 5 actually, I think, including today, and I took 1 already today at the office. Then this is take 1 capsule twice daily. So this is the steroids, I think, or something, to help again prevent ingrown hair, the red color this time. I store them in the fridge because they get a little stinky otherwise if you just leave them in regular temperature. At least the old ones did. I'm not sure about this, but I'll just store these in the fridge anyways. Pour and finish. So this should just be finished up, I believe, until it's fully done, but I'll confirm with him again. I think it's Renault here anyways. So this needs to be taken once at 8 a.m. and once at 8 p.m. And post-op instructions, he just wrote this here. The saline, spray routinely every 10 minutes. Be ahead of your pain the first night. Don't let your pain start first, especially if you had strip hair transplant. First night sleeping, if you have done work on front end, like you say, 45 angle, you'll develop swell. Okay, if you don't do this, for scalp hair transplant. So I think it's pretty much just what I just explained to you. It's just going into more detail. Yeah, and so anyways, and then he's nice to give like a timeline. The transplant hair start falling out. He gives you like a whole timeline when you can start what you should be expecting, which is pretty cool. I don't remember that there the first time. Maybe it was, I'm not sure, but that's pretty good addition. So, sorry I'm talking so fast. I know this is a long video today. So pretty much what I explained is the post-op procedures. I'm getting these bandages removed tomorrow. He said I could remove it myself, then apply first massage it, clean it, and then apply ACell. But because I did the grafts again at the back of my head, he's afraid that he doesn't want me to get shampoo on the grafts. So he'd like me to come in tomorrow. He's going to remove the bandages. He's going to clean it. He's going to massage it, and he's going to, I don't know if he's going to personally massage it himself, but he's going to massage it. He's going to apply the ACell on for me tomorrow at 2 p.m. I will document that video, and I'll do my next video up to date. And I hope, you know, this guy keeps you guys on the journey with me on my second hair transplant. Like I said, I'm very excited. The first results were awesome, and now that the hair is shorter on the sides, you can really appreciate the top head hair. I mean, it looks perfect. They did cut the sides of the hair with like a zero almost, and they left the top big like what I had at the Buzz 4. And it looks great, man. Like, this looks good. Even at this Buzz look, it looks cool. One thing I did do as a mistake is I shouldn't have cut the top at all when I buzzed it, because when he was applying the grafts on the back, he kind of wanted to see what hair was already previously transplanted and which hairs are growing long. So he knows those are good ones, and he could, you know, work around those ones. But I did cut it, and so he had to like review photos and kind of just review the hair. I mean, and that's how good the hair transplant is. He, at the same length, couldn't even tell which was transplanted and which was, you know, I mean, I'm sure with the microscope on, he figured it out. So it looks like he did a good job. Today I only did 900, about, I think, 60 grafts. Let's say about 960. And he did a lot of 3s and 2s and 1s. He kind of doubled up on the 1s so that they came out thicker, so they're closer to each other. And I mean, he got pretty good coverage with just 900. So this Thursday, I'm going in for the second day of the surgery. And honestly, I guess he's just going to cover up the rest that's missing and maybe thicken up this area a little bit with the rest of the grafts. I don't know. We'll see. And that should be pretty cool. And then we discussed even about lowering the hairline. I know a lot of you mentioned it. And he kind of drew where he would lower it, which would be like right here. And man, that would be amazing if I could get the hairline down there. But that'll be another 2,000 grafts. I don't know if I have a donor hair for it. If I don't, honestly, I'm very happy with these results already. If the crown is filled in, top grows out a little longer, leave the side short, very happy. I think it looks fantastic. And if you guys are balding and concerned, I mean, look, it looks awesome. Even with this little fuzzy hair on top. I didn't have that before. Hope this video wasn't too long. Hope this kept this, yeah, have a good one. And I'll be sleeping tonight with these on.